Good to speak
First,
to you
let me
again.
congratulate you with New Year.
Oh yeah, thanks. Thank you.
I wish you all the best in the new year. Let all your hopes and ideas and wishes come true. So all the best to you. Good luck, and I wish you also a strong health to be able
Same
to
to you.
accomplish everything.
Thank you. Yeah. We spoke a little bit before, and we got cut off. So I guess maybe do a recap of that, and then we'll continue.
Yeah, sure. I will recap it for you, everything. And if you don't mind, I have like a small slide presentation in front of me, just as a helping material. Okay.
No problem.
To recap it all, I'll first want to tell you that we are actually proud to present you our unique non-invasive early cancer detection method with the accuracy of up to 96%. According to the World Health Organization, regardless of their rapid development in modern biology and medicine, the statistical data are really sad because each year 8 million patients die from cancer. And every day 27,000 new patients are diagnosed with cancer, and this number is constantly growing. Due to late diagnosis, more than half of cancer patients die because manifestations of the disease appear only in advanced stages. And in the last 10 years, the number of oncology patients has increased by around 25% due to bad habits such as smoking, alcohol drinking, obesity, unhealthy diet, pessimistic mentality, and etc. So, in fact, there are so many reasons which can cause cancer, and medical specialists and doctors all over the world, they don't have a common ground about the actual reasons of cancer. But the evident fact is that the early detection of cancer is the key to successful treatment. So the average 5-year survival rate of cancer patients says that after treatment in stage 1 cancer, at the earliest stage of cancer, around 93% of patients survive, compared to only 13% surviving after treatment in stage 4. It means that if detected at early stages when there are no visible symptoms, cancer can be cured without any complex aggressive therapies. And the Vivint diagnostic screening test created by the scientists of our company detects cancer at its early stages with the accuracy of up to 96%, as I mentioned before, which is only comparable to biopsy. It can recognize the progressive disease with when other diagnostic methods are really helpless. And let me tell you a few words about the history of the method itself. It dates back to the early 1983. The development of this diagnostic method started at the Research Institute at the chair of genetics. Based on the cellular theory by Rudolf Virchow, a team of scientists was working on a diagnostic method by studying buccal cells. Buccal cells are cells from the inside of the cheek, because those cells are the fastest to respond to any changes in the human body. And it took around 28 years to collect a so-called deviation album, which established a relationship between cell parameters and body conditions. And it's laid a basis for the Vivint diagnostic method, the main idea of which is that any changes in the body manifest at the cellular level, including buccal cells. Thus, by examining 46 parameters of cells and their combinations, our system allows, with a high degree of accuracy, to detect oncological diseases. Last time I was showing you the procedure, the diagnostic procedure, how it looks. And let me just to repeat it for you. First, a patient card is filled out in the computer program. Then a buccal swab, which is a swab from the inside of the cheek, is carefully taken with a mouth spatula, just like that, a small spatula. It's completely painless and doesn't have any discomfort for a patient. Then the sample is carefully placed under the microscope, and there is a small camera built in the microscope which records the video from the sample and then transfers the data, the received data, to the processing center. The received data gets processed and analyzed by cell parameters and their combinations, and within several minutes, maybe it takes up to 10 or 15 minutes, and the program receives a printable report showing cancer lesions in the body, if there are any, predisposition or liability to cancer. And the third one is coexisting diseases according to the International Classification of Diseases. Of course, there are a lot of advantages of our diagnostic method comparing to other existing methods, which are: the first is a higher diagnostic accuracy. As I've already mentioned, is for some clinical trials showed that for some types of cancer, it reaches up to 96%, which is a really very high diagnostic accuracy. Then the second very important advantage is that it causes no pain, no discomfort or side effects. The third is that we can get a quick test results within 15 minutes. Within 15 minutes, any person can actually know if there are any cancer lesions in the body, or whether the person is liable to cancer, to develop it in the future. And one of the biggest advantages is also portability of equipment. I showed you last time, it's only a small microscope and with the inbuilt camera, a laptop, and a mouse spatula. So this all what you need to take the sample and to get a result of the diagnosis. And also, unlike other diagnostic methods, it differentiates between chronic inflammatory conditions and cancer, because sometimes cancer can be confused with some inflammatory chronic conditions in the body. So these are main advantages.
So I think I get the gist of why this is valuable. My question, a lot of questions come to mind. And the first thing I'll say is I'm obviously not qualified to make an assessment of this technology. I mean, I have some science background, but I don't really know what. Honestly, the feedback I would give as a layperson is that it sounds too good to be true, to be honest. So if it's true, it's awesome. If it's I'm honestly a little bit I'm a little bit skeptical about some of these claims. It's awesome if you can demonstrate it. That's fantastic. So the question is, well, a lot of questions come to mind. One is, I think that this is you need to be pitching someone who is qualified to judge whether these are.
Yeah, I understand what you mean.
Whether all these things are valid. It's very difficult for me to make an assessment. But I'm curious, how does the token? Are you doing a token sale for this, or are you just raising money privately? What are you doing for this?
Now we are trying, actually this diagnostic method is already working. So the franchise was launched in 2014, and we opened a lot of diagnostic rooms all over our city, and actually beyond our city, all over Ukraine. And actually there is one major lab network in our city, and we showed our diagnostic methods, and they run some internal clinical trials, and they don't mind to include it to their list of the diagnostic procedures. The only thing which they require is a certificate, European certificate, and it all needs money and time. So what we are mainly focused now is just to get licenses and certificates in Europe and CIS countries, because we have we have patents in Ukraine and Russia. So only those two countries which gave us patents. So our primary focus and goal now is just to raise money, to raise funds, to complete all those certification procedure abroad, to be able to spread it, to make it available, widely available to ordinary people. Because so many people are like you, they're skeptical, and they don't really have enough medical knowledge, to be able to assess whether it's working or it's not. So
yeah, I mean, so you have patents in Ukraine and Russia, you said?
Yeah.
And have you filed for patents in other countries? Like a worldwide patent?
Sorry?
A worldwide patent? What is it called? PCT, I guess? I don't know if it's called the same.
No, not yet. It's just in our plans. We've just applied the application to the International Intellectual Property Organization, which will also help us to gain worldwide reputation if we will be able to finalize to complete the procedure. But so far we have only Russian and Ukrainian patents.
Why don't you file a provisional US patent or something? And then
US patent, because to be able to reach to US market, it really takes time, and the certification procedure.
Yeah, but I'm not talking about the market. I'm just talking about filing a provisional patent. That I've done that myself. It costs like $500, $500. You could do that. I mean, at least get the information filed as a provisional patent, and then then move to a utility patent, and then do a worldwide patent, and you'll be in a great position. I mean, really, you probably, it seems to me, you need to partner with a big company that can take this to another level, because you need to probably raise a lot of money to make the impact that you could make. If this is a genuine product, which I'm not I'm not trying to be rude, but it's very difficult for me to discern. And but if it's a genuine product, you need to raise a lot of money, because medical stuff always. I mean, I used to be a scientist in a pharmaceuticals company in the US, and I'm connected to a lot of scientists in pharmaceuticals companies in the US. I know the procedure to get anything done is very, very difficult. So you definitely need patents, and then you need to start talking with people who do this stuff all the time. Why are you doing a token sale, or are you just doing a general raise? Because I'm still not clear on that.
We are doing token sales, and pre-ICO we had it in December, and now on the 15th of January we are starting ICO campaign. I mean. Okay. And we are going to sell tokens, which will help us to raise some funds, to get a little bit closer to the next step, to the next level of our main purpose. So
they're obviously not. They're not utility tokens. Obviously, they must be securities, right? It's effectively stock in the company, and you're tokenizing them and selling the tokens, right? Something like that.
Actually, those tokens, it will be like a shares in the company. So so those people who will invest money in the project, they will have two options: either participate in the distribution of the company income by the end of the day, or otherwise they will they could buy the tests, the diagnostic tests, with a big discount of 30%, and then either resell them to wholesale customers like clinics, laboratories, or medical specialists in private practice, or use them by themselves.
Okay. Okay. Are you registered with the SEC in the US, or are you not selling to the US?
No, not yet. No. Basically, the US market and the US medical field is in the future, but no in the nearest future, because we realize that we have to prepare, ourselves very good to be able to hit the US. Because
I mean, with the token sale, are you selling tokens in the USA? because okay, I'm not going to lead you into. I'm not going to like. I'll just explain my reasoning first. I mean, you need to be a registered. If you're doing a token sale in the US for something that is not a utility token, that is a security, I think you have to be extra careful, make sure that you're registered before you promote in the US. Otherwise, there are going to be some sort of issues. So I'm just checking if you have done that or not. And if you haven't, then I'll just
You
assume
mean
you're
official
blocking.
registration before selling tokens?
Mm-hmm.
Oh, so there is some authority or like a body where you have to.
Yeah. Yeah, be careful about that. Be very careful because they'll hunt you down to the end of the earth, I think.
Okay, thank you for information.
And really, I mean, you can just not sell to. I think you can. I suspect you can just not sell to U.S. customers during the ICO. But I'm not a lawyer. I don't know. I don't really know the details of that. Okay. So all right. Yeah, you need to speak with someone who knows what they're talking about, and I'm not that guy. I don't know. I'll have a think if there's anyone I know that could talk to you about this and make some sense, because the whole whether it could be a huge opportunity, but cancer cures are like people promise to cure cancer all the time with with everything from prayer to they're gonna put crystals on your head to all sorts, and on the other hand, people are making important efforts to solve the cancer problems. I just don't know how to tell whether this is one or the other.
So you're like very skeptical about the whole idea. What is your main concern?
Well, I just don't. It's very difficult to tell. I'm not qualified to tell whether this is a good product or not. It's if we talk about web or internet or even crypto technology or something, I can discuss that with some understanding. With this, I have no understanding. I just don't know.
Okay, in your opinion, what should be done by us in the next step? What next step should we take in order to get closer to our primary goal?
I mean, if you're raising money, then and it seems like you've closed your pre-ICO, then you are on the right track. Probably it seems like you're able to raise some capital and move to the next step. So that's great. I mean, you definitely need patents everywhere, and if you have something unique, you need patents, and I'm everywhere. I mean, the US is one of the most. I'm not from the US, so I can say this, but I think the US is one of the most important countries to register in, and you should do that as soon as possible, and then you should move on to an international patent. That's just my take, but I'm sort of speaking from a high level and just the understanding I have. So I think you should do that, and I think you should, if you really have something that you can prove works, I mean, you should go speak to some big companies that do create those kinds of things and partner with them somehow, and go
so
massive.
You mean from our part on our part there should be like more paperwork done to get more proofs to move on.
Yeah. I mean, honestly, it's very difficult to. People like me should not be judging whether this is good or not, right? This should be judged by medical professionals and scientists.
Yeah, I do agree
and I'm
with
not
you.
a scientist anymore. So even a regular, I know a few scientists, and I don't know if any of them could really answer this, talk about this with any sense either. It's very specialized, isn't it? You need some real experts to give you some kind of stamp of approval, and then you'll have no problem, because everyone knows medical stuff makes loads of money, so that's not going to be an issue.
Okay.
But this is, I mean, as far as my expertise, I guess, is in cryptocurrency and things like that. That's my main field of interest, and so this doesn't really apply to that. I mean, hey, if it works, it's cool, and I like it, but I'll reserve judgment. And if you I'll try and find someone who does have the ability to ask the right questions here, and then we'll see where that goes.
Okay. Will appreciate all your efforts if you can be of any help for us. Thank you so much.
No worries.
And thank you
someone may contact you through the app, or you know, hopefully you hear from someone, and I'll email you if I find someone in my network.
Okay, thank you so much.
You're
Have
welcome.
a nice day.
Thanks very much for your time. Cheers.
Yeah.
Bye-bye.
Bye-bye.
Bye.
Понял?
Понял.
Ну, короче, типа говорит, что вам для того, чтобы выходить на мировой уровень, у вас есть какие-то доказательства того, что это работает. Не просто быть голословным, да.